Welcome to this video about the bladder. The bladder is a fascinating organ, responsible for storing urine produced by our kidneys. It plays a crucial role in our urinary system. Today, we'll explore its anatomy and functions, helping you understand how it works and what can go wrong. Bladder location. The bladder is located in the lower abdomen. If you place your hand just above your pubic bone, that's roughly where it sits. For men, it's situated above the prostate gland. For women, it lies just below the uterus. Bladder structure. The bladder is like a stretchy balloon. When it's empty, it has a triangular shape, but as it fills with urine, it expands. The outer layer, called the serosa, protects it, while the detrusor muscle helps it contract and release urine. This muscle action is key to the bladder's function. Urothelium. The inner lining of the bladder, known as the urothelium, is quite remarkable. It prevents urine from leaking back into the body and can stretch as the bladder fills. It also helps signal when it's time to urinate, thanks to its sensory capabilities. Trigone area. Inside the bladder, there's a special triangular region called the trigone. This area remains smooth and does not expand like the rest of the bladder. It directs urine from the ureters to the urethra, acting like a funnel. Blood supply. The bladder has a rich blood supply, mainly from the superior and inferior vesical arteries. These arteries are branches of the internal iliac arteries. Good blood flow is essential for bladder health and function. The blood leaves through the vesical veins, heading back to the internal iliac veins. Nerve supply. The bladder's nerve supply is both complex and crucial. It includes autonomic nerves, which manage involuntary actions, and somatic nerves for voluntary control. Sympathetic nerves help hold urine by relaxing the bladder, while parasympathetic nerves trigger urination. Ureters. The ureters are two tubes that transport urine from the kidneys to the bladder. They enter the bladder at an angle, creating a one-way valve that prevents urine from flowing back into the kidneys. Each ureter is about 25 to 30 centimeters long. Urethra. The urethra is the tube that carries urine out of the body. It differs in length between men and women, longer in men, passing through the prostate and penis, and shorter in women, ending just above the vaginal opening. Sphincter muscles around the urethra help control the flow of urine. Bladder capacity. Did you know the average adult bladder can hold about 400 to 600 milliliters of urine? You start to feel the urge to urinate when it's about half full. This sensation is triggered by stretch receptors in the bladder wall. Of course, bladder capacity can vary depending on age and health. Micturition process. Micturition, or urination, is a process that involves both voluntary and involuntary actions. When the brain signals that it's time to go, the bladder contracts and the sphincters relax to let urine out. It's a finely tuned coordination between the brain, spinal cord, and bladder muscles. Detrusor muscle function. The detrusor muscle is key to the bladder's ability to empty. It contracts to push urine out and relaxes to allow the bladder to fill. Proper function of this muscle is essential for bladder control. Problems with the detrusor muscle can lead to urinary issues. Internal urethral sphincter. Located at the bladder's neck, the internal urethral sphincter helps keep the urethra closed. It's controlled involuntarily by the autonomic nervous system. During urination, this sphincter relaxes to allow urine to flow out. External urethral sphincter. The external urethral sphincter surrounds the distal part of the urethra. Unlike the internal sphincter, it is under voluntary control. This means you can consciously decide when to urinate. Dysfunction in this muscle can lead to incontinence. Bladder control mechanisms. Bladder control involves a complex network of neural pathways. The brainstem's pontine micturition center coordinates the entire process. The cerebral cortex can override this to delay urination when necessary. Issues in these pathways can lead to bladder control problems. Common bladder disorders. Bladder disorders are quite common. These include bladder infections or cystitis, often caused by bacteria. Overactive bladder results in frequent and urgent urination. Interstitial cystitis is a chronic condition that causes bladder pain, and bladder stones can form from concentrated urine. Diagnosing bladder issues. Diagnosing bladder problems typically starts with a physical exam and medical history. A urinalysis can reveal infections or blood in the urine. Imaging tests like ultrasound or cystoscopy provide a clear view inside the bladder. Urodynamic tests measure how well the bladder is functioning. Treating bladder conditions. Treatment depends on the specific bladder condition. Antibiotics are commonly used for bacterial infections. Lifestyle changes and medications can help manage an overactive bladder. In severe cases or structural issues, surgery might be necessary. Maintaining bladder health. Maintaining bladder health is important. Staying hydrated helps flush out toxins and bacteria. Regular urination can prevent bladder stretching and infections. Pelvic floor exercises strengthen the muscles supporting the bladder. Avoiding irritants like caffeine and alcohol can reduce bladder irritation. Conclusion and takeaways. The bladder is a vital part of our urinary system. Understanding its anatomy and function helps us recognize potential issues. Early diagnosis and treatment are key to preventing complications. Maintaining good bladder health is essential for our overall well-being. Thank you for watching. Please like, share and subscribe.